A surgeon performs an anterior lumbar interbody fusion at L4-L5 with insertion of a biomechanical device. A separate posterior decompression at L4 is also performed. How should this be coded? A. Report the fusion only. B. Report fusion and decompression separately with modifier -59. C. Use a comprehensive spine procedure code. D. Code decompression as bundled. Answer, B. Since the decompression is separate and not part of the fusion, both should be reported with a modifier to indicate distinct procedures. A patient presents for repair of an inguinal hernia. During surgery, a sliding hernia involving the bladder is discovered and reduced. What is the correct approach for coding this case? A. Use unlisted hernia code. B. Use standard hernia repair code only. C. Code hernia repair with bladder involvement. D. Report exploratory laparotomy. Answer, C. A sliding hernia involving another organ should be reported with a code indicating organ involvement, if available. When coding destruction of 4 premalignant lesions and 3 benign lesions via cryosurgery on separate anatomical sites, which modifier is needed? A. -59. B. -51. C. -25. D. -76. Answer, A. Modifier -59 distinguishes the two procedures as separate when performed on different lesions/sites. A radiologist performs and interprets a CT angiography of the chest and abdomen for pulmonary embolism and AAA. How should this be coded? A. Report single chest CTA code. B. Code chest and abdomen separately with modifier. C. Use unlisted radiology procedure. D. Only code chest, abdomen is incidental. Answer, B. Separate areas imaged with interpretation should be coded distinctly using the appropriate CT angiography codes. A patient undergoes a partial colectomy with end colostomy. The next day, the surgeon performs a reoperation due to bleeding at the colostomy site. What modifier is appropriate for the second procedure? A. -58. B. -78. C. -79. D. -24. Answer, B. Modifier -78 indicates a return to the operating room for a related, unplanned procedure during the postoperative period. What is the correct code when an emergency department physician removes a fishhook embedded in the soft tissue of the ear under local anesthesia without incision? A. Foreign body removal, ear. B. Simple repair. C. Unlisted procedure. D. Debridement. Answer, A. CPT includes specific codes for foreign body removal in soft tissues, including the ear. A Medicare patient receives a screening colonoscopy which turns into a diagnostic procedure due to discovery and removal of a large polyp. How should this be coded? A. Report diagnostic colonoscopy only. B. Report screening with modifier PT. C. Report polypectomy only. D. Use unlisted colon procedure. Answer, B. Modifier PT indicates a screening colonoscopy converted to diagnostic, required for Medicare claims. A patient has 3 deep excisional biopsies of muscle from different limbs during the same session. What is the correct coding approach? A. Report once with quantity. B. Report each with modifier -59. C. Use one code with -51. D. Code only the largest. Answer, B. Separate biopsy sites require separate codes with -59 for multiple distinct anatomical areas. What is the correct coding for a skin graft, full thickness, harvested from the groin and transplanted to the cheek due to avulsion? A. Code cheek graft only. B. Code both harvest and graft. C. Code graft and use modifier -59. D. Code harvest as bundled. Answer, B. Full thickness grafts require separate coding for both harvest and recipient site. A cardiologist places a dual-chamber pacemaker with fluoroscopic guidance and intraoperative interrogation. What coding combination is correct? A. One code for pacemaker. B. Code placement and guidance separately. C. Report placement and interrogation with appropriate codes. D. Use unlisted cardiovascular procedure. Answer: C. Pacemaker insertion includes interrogation, but imaging guidance may be reported if not bundled. A pathologist performs a level V surgical pathology on a resected colon specimen with margins. What CPT code level applies? A. Level 1. B. Level 3. C. Level 4. D. Level V. Answer: D. Major resection with examination of margins qualifies as Level V pathology. Which of the following requires reporting of time-based anesthesia codes? A. Nerve block only. B. General anesthesia for total knee arthroplasty. C. Epidural catheter placement. D. Moderate sedation. Answer: B. Time-based codes are used for general anesthesia, calculated from start to end of anesthesia care. In CPT coding, what does a semicolon, winky face, indicate within a code description? A. Mandatory modifier use. B. Separate procedures. C. Main entry with indented descriptors. D. Change in category. Answer: C. Semicolons indicate base code language that is carried over to indented codes that follow. A patient receives a transthoracic echocardiogram with color flow Doppler and spectral Doppler. Which combination is correct? A. Report two separate codes. B. Use the highest code including all components. C. Code separately with -51. D. Use unlisted echo code. Answer: B. When multiple modalities are used, report the comprehensive code including all services. What is the correct approach when reporting destruction of 10 benign skin lesions via laser therapy in a single session? A. Code once with 10 units. B. Code destruction x 10. C. Use bundled destruction code. D. Use lesion destruction code with number specified. Answer: A. CPT allows reporting quantity of lesions treated when the same method is used. During outpatient surgery, the surgeon removes a non-palpable breast mass guided by radiological wire localization. Which modifier may be required? A. -50. B. LT. C. -26. D. GC. Answer: B. Laterality modifiers, LT/RT, are often required for procedures involving paired organs. What is the purpose of Category 3 codes in CPT? A. For temporary codes not yet FDA approved. B. For non-reimbursable services. C. To track emerging technologies and procedures. D. To replace HCPCS Level 2 codes. Answer: C. Category 3 codes track new or experimental services and allow data collection. Which modifier is used when a distinct procedural service is provided in the same session? A. -25. B. -51. C. -59. D. -24. Answer: C. Modifier -59 indicates a procedure/service is distinct and separate from others on the same day. What does modifier -52 represent? A. Increased complexity. B. Repeat procedure. C. Reduced services. D. Technical component. Answer: C. Modifier -52 is used when a service is partially reduced or not fully performed. A patient with chronic sinusitis undergoes functional endoscopic sinus surgery, FES, with polypectomy and sphenoidotomy. How is this reported? A. One code for FES. B. Separate codes for each sinus area. C. Use unlisted ENT code. D. Code only one sinus region. Answer: B. CPT allows coding each sinus area addressed during FES separately. For Medicare patients, what modifier is needed when the physician performs only the interpretation of a diagnostic test? A. TC. B. -26. C. GA. D. GZ. Answer: B. Modifier -26 indicates the professional component, interpretation only, of a diagnostic test. When is modifier -24 appropriately used? A. 2 surgeries in same session. B. E/M unrelated to surgery during global. C. Bilateral procedures. D. Assistant surgeon. Answer, B. Modifier -24 is for E/M services during the global period that are unrelated to the original surgery. A coder is reviewing documentation with a missing procedure note but clear evidence of surgery. What is the best next step? A. Query provider for clarification. B. Code based on assumptions. C. Use E/M only. D. Submit unlisted procedure code. Answer, A. When documentation is unclear or incomplete, querying the provider is required before coding. A patient receives an allergy test with 30 percutaneous tests and 15 intradermal tests. How should this be reported? A. Code total units together. B. Report both procedures separately. C. Use unlisted allergy service. D. Report only highest level. Answer, B. Different test types, percutaneous and intradermal, require separate CPT codes for accurate reporting. The global surgical period for a major procedure typically includes A. Day of surgery only. B. 10 days. C. 90 days. D. 60 days. Answer, C. Major procedures have a 90-day global period covering pre-, intra-, and postoperative care.